thank you for joining us today on Matters of Substance. This is Carly Samayoa, one of your hosts, and with me is Kaitlyn. Hello.
Good afternoon.
Good afternoon. Thanks for joining us, Kaitlyn.
Yes.
Today we have Diana Ilchi as a guest, and she is the older adult prevention educator at Porter Stark Services. What's really cool about the grant that she coordinates is it addresses the needs of people aged 50 and above, which is something that I don't think is very common in a lot of the prevention that we have here in Porter County. I'm not sure how it is across the nation, but I know here in Porter County, I think we're a little bit limited in that. And so we're so excited to have you on the show with us today, Diana. And just to let everybody know listening right now, I want to make sure that you are aware of some of the resources that Diana is going to discuss, or where you can find them, rather. So it's really important to let you know up front, you can find a lot of the resources that Diana is going to discuss today at porterstark.org/lifeonpurpose. So Diana, please share with us a little bit about what you have going on in the community.
So maybe I should start with what even created the issue with getting the grant in the first place, which was new to me and probably new to every listener. Most of us did not know or are not aware that nationally, within less than a decade, the number of older adult population has gone up about 6%. But the amount of people that are receiving services for substance use has gone up over 54%. So the SAMHSA, which is a federal agency, gave the state of Indiana some funding for the first time this year, and there are 4 of us in the state doing older adult prevention for the first time.
That's amazing. So you're kind of leading the pack then with one of four agencies. That's a big deal.
Yeah, and in the beginning, it was a lot of just educating myself, because I heard that and said, what is going on with older adults? I am an older adult. So I spent the first few months in this grant just trying to be educated about what is going on nationally, what's going on in the state of Indiana, and then what's going on in Porter County. So I did a number of just researching, some hours of researching and learning.
Mm-hmm. And were there any things that were compelling that, maybe you didn't know when you began doing the research to prepare yourself for the grant?
One of the big picture items that doesn't just relate to older adults, but relates to being in Porter County, out of our 92 counties, we're number 9 for substance use related to alcohol. So alcohol use in Porter County is significant, and among older adults, it is usually the drug of choice first, unfortunately, is alcohol, because it's easy to access. And those of us that are older adults, including myself, do not really know the guidelines with alcohol. And that's one of the things that I learned first is, like, what are the guidelines for people 60 and older? How much alcohol is safe to drink? What isn't safe, and why? So I did spend some time with that too.
So I think we need to know, what is the appropriate amount?
That is a really good question. And it actually, once I learned it made a change in even my own thinking. So if you're on medication that even allows you to drink, which many of us that are older adults are on medication where alcohol would be harmful or not, or could even be dangerous interacting with our medication. But if you can drink, for women, it's 1 drink a day. For men, up to 2, no more for either male or female than 7 drinks a week, if it is even safe to be drinking.
Wow, and I think that changes pretty drastically for what, if you're not in the category of older adults, I believe it's like 4 drinks for women or for men, but it's 3 to 4 depending on your gender. So that's a pretty large reduction.
And I didn't, again, one of the things in my generation, because we are the baby boomer generation, and I'm included in that, is we have this idea that substances, alcohol, and even drugs like marijuana we have a low perception of harm. We grew up in the Vietnam War era, and we tended to think of ourselves as like, this is not going to hurt. So we kind of have that mindset. So it did change my mindset when I started to understand why is it that alcohol becomes a problem for your body when you get older.
So, share with us. I think I read a little bit about this based on some of the information you had given me previously, but I know risk of dehydration, and there's quite a few other factors that make it riskier. Can you share what those are?
Yes. So you're right. You still remember that conversation, and for women especially, our bodies do not retain water very well, but men as well. But for women, that's why the number for drinks is so much lower. And we also, I was just teaching this yesterday, that actually by the time we're 30, we start losing muscle mass. So we do need to keep active and exercise. But when we get older, there is a loss that just comes with age. And that also impacts how our bodies absorb things. Our organs, unfortunately, have gotten older, and our bodies don't process things the same way either. So once you're, 60 and above, things change, whether we like it or not.
Yes. So it sounds like you mentioned that alcohol is like the main substance of use for older adults. And it sounds like there's a lot of harm that can come with that. And I know I read in something that you had provided that sometimes the onset for this disorder, substance use disorder for older adults, actually happens quite, not like it's not substance use disorder before they become an older adult. It's a triggering event later. So what does that usually look like? Like what starts that pathway?
Yeah, that is really unique with the older adult population. If somebody did not already have substance area issues before, it's common for at least 30% of the older adult population to have some depressive event happen to them, and then they start drinking with that, or they misuse their prescription medication because of what's happening to them emotionally. And that is called late onset drinking. And yeah, it is something that happens with the older adult population with some people. And if you think of older adults, we are wiser. There's a lot of capability. We've lived through a lot. But that's a time of life when more things happen to you that'll change your circumstances very quickly, including even retirement that has a positive side. It also has a negative side, and depending upon where people are at emotionally, retirement can be very stressful for someone. You can lose a spouse or a loved one as you get older. You may move and lose your support system. So there's a lot of changes that can happen as you get older, and so those can lead to depressive events.
So when somebody is going through some of these changes, what can they do to help themselves, or to get resources around themselves to make sure that they don't start maybe drinking more than they should, or using other substances to cope? Like what is out there for them to help them through those moments?
That is really a good question to ask. I think one of the things that come with this generation, and I myself, I'll be 68 in July, we also tend to have a stigma attached to us that it's not okay to ask for help, or that we are ashamed that we made it through all these situations in our lives, and now we're struggling with coping. So we're, having an extra drink at night, to fall asleep, those kind of things. So the first thing is just even awareness. Like for me, just learning the guidelines helped me change a few things in my own life. And I was not going through depressive events, but I can imagine if you are, just being aware and saying, wait a minute, I am drinking instead of, sleeping. I'm having trouble sleeping, or I'm not eating as well, or I'm really down today. Acknowledging it first, and then getting help with either your doctor or talking to a friend, getting out and doing something, even with the pandemic, with people struggling. I have actually discovered there's a group called Cyber Seniors, and you can get a hold of them, and they can teach you how to use technology, so you can connect with your grandkids by Zoom if you don't know how, or FaceTime. But connecting with people is a huge thing. And then speaking, especially to a medical provider, getting a counselor, just starting to say, this isn't working for me. I'm seeing a change in myself.
Yeah. That's amazing because I think a lot about my mom, who isn't yet a senior. She still struggles with technology. So I kind of, thinking of somebody who maybe is a bit older than her, I would imagine they might have some of those same struggles. And I know for her during the time of quarantine, that was a very hard time. It was hard because she didn't have those connections. And so it's great to know that there is a resource out there that if it's on social media, it's pretty accessible to probably everybody listening. So that's just, I don't know, that really makes me happy.
Yeah, that helps. And a lot of people, if they have connections with churches or other organizations, there may be, some youth that are willing to help somebody learn. One of the things Cyber Seniors does have is a mentorship. So you can get on their website and find out like how to hook into a younger person that could help you learn how to use your technology if you don't know how.
Oh, that's so awesome. I love it. That's amazing. So in addition to Cyber Seniors, you mentioned family, friends, healthcare professionals. Those all sound like really great, solid resources. And then I know that you have some programs that are to kind of help prevent substance use disorder. Do you want to share a little bit about those?
I do.
Yay,
thank you for
thank
asking. So there are very few programs for seniors that are called evidence-based programs, and that means that there's research behind them that they've made significant changes for somebody. And right now, we are offering a course called WISE, which is so appropriate because seniors are wise. And it is actually the initials are the Wellness Initiative Senior Education. And so I am setting up, I have a class going right now at Porter Stark. I will soon have a class going on at Campbell Street Cafe. I meet with the YMCA here in town for another class to be set up. So as seniors are vaccinated, this is moving to more in person. We were doing some on Zoom. So there wasn't much advertising. That was a little difficult for me. But the Wellness Initiative, it is a 6-lesson course, 2 hours at a time. And it teaches you really a lot about like what it means to be, your body changes aging, how to deal with your medication. It does have a chapter on substance use. It has a chapter on diversity, because we just group seniors together and there's such variety of diversity among that, 65 and older or even 50 and older population. So that's part of it. Coping skills are part of it. Learning to identify depression, all of that is part of that course.
Is there, when they're learning to identify depression, I hope you don't mind, but I'd love for you just to touch a bit more on that so that listeners might have a few skills to take away from this conversation so that they can identify it either in themselves or within their family members.
So through the process of learning from this grant, I discovered that there's actually a specific screener for older adults. So what we may use for a younger person to screen for depression is not the same, and it's called the Geriatric Depression Screener. And I have another program that we use that screener. It's called Healthy Ideas, and I have 4 interns from Valparaiso University from the Public Health Program, and we are right now partnering with the VNA for Meals on Wheels to do that. I don't know if you want me to talk specifically about the screener, but it's easy to Google to find, but I actually brought one with me in case you wanted me to. I do have a copy of it, and it's short.
Yeah, or maybe like some symptoms or some of the questions that would be on the screener. Maybe we could read some of those so that the maybe the person listening or listening on behalf of someone may be able to say, oh, okay, so that, if someone is feeling maybe like this, maybe that's something I should look out for, type of thing.
Yeah, absolutely. I'm kind of looking at it right now, and I see that some of the questions include, do you often feel bored? That's a a good indicator, especially here right now in this time with COVID. I mean, sometimes we get a little bored. So I guess it's important to also take away that this is a list of things. So, depending on how many you check yes or no to, that's going to give you the idea of whether or not it's something to move forward on. So are you in good spirits most of the time is another question. Do you often feel helpless? Do you feel full of energy? Do you feel your situation is hopeless? That's like 5 of the 15 questions, which I think would take maybe a couple minutes to answer, right?
Yeah, and actually a score of 5 or more indicates that you're at least experiencing some form of
Okay.
depressive symptoms. It doesn't, even the program I have, we don't diagnose depression, but you'll say this is at risk for depressive symptoms, and then state look at what can you do. You need to recognize that something's going on.
So when you guys do the screening and you determine, it looks like you have 5 or more indicators, what's the next step for the person?
You actually, if you're meeting with a healthcare provider and they do this with you, or a therapist, they would take this at a little bit different level, because we are doing it as just saying an awareness. We are teaching the person. We talk then about, we have to do, once you get a 5 or more, you at least have to address suicidal ideation to look at what is else going on. The research for our program, Healthy Ideas, has shown that it is very rare that we ever have somebody that they've ever had to look at and say, yeah, this person is feeling suicidal. But that is the next set of questions you would look at. And then you actually are teaching the older adult how to look at what makes them happy, where they get joy, where do they get energy, what can they change. So you're empowering the person. And that's how that program works. You empower them to make changes, but with guided conversation, questions, lists of things that the person might be interested in doing. So it all helps.
Yeah, that's nice. So I like that approach, right? It's like, okay, we're identifying that there may be some risk. And so now we're going to give you some tools that will help. Because I mean, while I'm not opposed to referring obviously out, I mean, there's nothing wrong with that. And I think that in a lot of cases, that's a need. But if you can address some of the things that might help the situation that don't necessarily have to be with a service provider like a doctor, then I think you're giving people good tools to walk away with that they can apply in their life. And I find, personally, I find a lot of value to that. And I'm really happy that's a part of the program.
It's really interesting because one of the concerns that those of us, including myself, are trained in, this program's been around for many years already. So there's a lot of data behind it. And they've discovered that even if somebody doesn't follow up with their doctor and their score was 8 or more, and of course they're not suicidal, even just meeting with somebody and having come up with goals makes a difference. Just setting goals and follow up, meeting once or twice with somebody, following up, really has changed just mood. So we really just are saying, what can we do to help somebody's mood? And we're using this as a guideline.
That's wonderful. I love it so much. And I can, like you just said, like there's research that shows this is helpful, and you can't really get any better than that. We have, I know for when we talk, you mentioned evidence-based earlier, and sometimes I don't know if all of our listeners know exactly what that means, but basically evidence-based means that something has been repeated enough to show that there is success in the program and that it works with its intended results are achieved.
Yeah.
And so that's what you're saying about this program here is that, the intended results, which are changing the maybe depressive feelings and
the mood.
The mood.
Specifically, yeah.
You changing that is working. So that's amazing. I'm so glad that that's something we offer here in Porter County and possibly across 3 other counties somewhere in Indiana. And so you mentioned, can we go back to your WISE program really quick? Because
Sure, I'd love to.
Yeah, I'm thinking that was the one where you are doing the classes, correct?
Yes, yeah. And we are now in person.
Yes.
So we are just adding, I am doing a small group in person at Porter Stark right now.
Okay.
In fact, we started yesterday, lesson 1.
Awesome.
I know, yay! Yeah.
I bet that was just really exciting. I don't know as far as like the members who do you have, there's probably groups. Do they go through the 6 weeks and then a new group of people come in? Yeah. But so to be able to bring everyone back in person, or the people who are able based on, their comfort level and stuff. But I bet that was just an enriching feeling, like, wow, we have in a sense kind of made it from the other side of what was taking place last year. So I bet that was very nice.
And there's definitely a feeling of openness, that because most of our older adults are either at the second vaccination or are fully vaccinated, because we're at 40-year-olds right now in Indiana that are signing up. So yeah, this last 2 groups I was able to do in person, very small. The one I did before this, we finished Friday, we were pretty much spread out in a gym. And even with this group, we keep our masks on still, and just because we're still kind of adjusting to this. But yeah, at least we're in person. We did have a Zoom class prior to that.
So I wanted to I just want to know, how do people get in contact with you or with somebody from Porter Stark to get enrolled in this program? I mean, we have that here in Porter County. I guess I should clarify. Here in Porter County, how do people get enrolled in this program that you offer?
So even the things I mentioned, like the geriatric depression screener, the ways of coping better. So we have a website that's specific to older adults now.
Thank you so much for sharing that, Diana. So I just want to make sure that the listeners heard that. The website that they can learn more about what you just discussed is porterstark.org/lifeonpurpose.
And there are articles on there. There's a whole section on coping and self-care. There's a section on alcohol, the guidelines. There's an alcohol screener that's, again, specific for older adults, and some articles related to what is going on with our bodies and why alcohol is a concern for us with drinking too much. And there's a section on depression, and I'm trying to think of that. Yeah, and medication. Oh my gosh, there's a whole section on medication and how to manage your medication and adhere to your medication, because that is the other area of great concern among older adults, and that's a national problem, which is another reason why we have the grant.
I was just going to ask, as you were kind of talking about that, I know medication is a huge thing that needs to be examined, and we have, our prescriptions are very specific on how we have to take them, and I know that there's mention sometimes that maybe an older adult doesn't always take them exactly correctly because of varying reasons. I don't know the reasons, of course, but I read about that before, and I know it's so important to make sure that you are adhering to your medications the way that they're prescribed. And so I love that Porter Stark has like a section you can go to really kind of help solidify some of those ideas.
Yeah, well, there's a really amazing cartoon in the WISE curriculum. It's one of my favorite things that I came across since I've been doing this. And it shows a timeline. And it has the little baby, and it has the toddler, and it keeps showing, and it's pictures. And it will list the medications that might be common with that age group. So you look at your young children, and they're looking at amoxicillin, maybe medication for different infections. My mind just went blank because I could see the list as you go through these pictures, the list gets longer. And when you get to the older adult, it shows a gentleman in a wheelchair, and every medication is in that age group. So it's like taking what was younger is still going on, and then that much more. And it was pretty surprising to me that it is very common for older adults to be on 5 or more medications, and some are 8 or more. It's very common, which is then the concern of paying attention to how medications interact with one another, following the directions, because the more you take, it's easier to skip one, forget one. So trying to keep that going. And then there's also those conversations that older adults do not have very often with costs with their doctor. You know, they'll often get the script and they may ask side effects or they may not, but it's been known that they won't ask for costs, and then they get to the pharmacy and they don't fill it. So that is also a concern. So there's many concerns related to older adults. It was surprising to me that Porter County had a significantly higher than state average of opioid prescriptions floating around. So I can see where that was why they wanted this grant to also look at older adults, because pain medication is not unusual among this age group, and a lot of people do not know what pain medications are in those categories and what other choices they have, or they mistake them, or they drink with them. All of that becomes, so the medication is quite a large area of focus.
Yeah, I think kind of just thinking about what you said is mistake them on accident. I mean, that can be a pretty severe thing. You know, if you're accidentally taking more opioids than you intended, I mean, there could be a severe outcome from that. That can be very dangerous to the person.
Yeah, or they again, you may not realize that's what you're on. You may not understand it or pay attention to the side effects. One of the things the WISE class teaches, and I think this is awesome, it's called the brown bag doctor visit. And it is taking your medications with the pill bottle, not just the pills, because that won't help, but you're putting your pill bottles in like a bag. Hopefully, if you're only on 3 to 5, you'll have a lunch bag. If you're on more, which happens, you may need a bigger bag. And you take it to a pharmacist or a doctor, and you re-look at your medications. We had a person in our one of our WISE classes who actually shared this with a friend. And she told us that her husband decided to take his medication in and discovered that actually 2 of his medications were causing him some harmful effects. And the doctor, because you often have different doctors, and that happens when you're older too. You may have a doctor looking at one area of your body or another, and it happens at any age. We have different specialists. That's the way it works. And so yes, you try to get over everything, you try to explain everything, but it doesn't mean it all gets in. Or you as a person may not have understood what they said at the appointment. And so you didn't really understand what you're taking. So I just love that. My husband took one of our Zoom Wise classes. I was like, oh, please take the class because I need another student. And it was surprising because I didn't know what he was going to get out of it. And he ended up doing that very thing, going back. And he talked to his doctor about getting off a medication. And he said, can I do this if I do this instead? And just those conversations are very important.
You know, someone like I had grandparents, I was their caregiver for a while, and my grandma, you know, she was in kind of the beginning middle stages of dementia, but even before then, she was not really big on taking her medication. She just didn't want to take it. And it was always like a big ordeal every morning. She'd take one at a time, and there were like 8 of them. But my grandpa, what he did was he had a little piece of paper, and he was really diligent about his medicines. He wrote what they were with the generic and the milligrams, and he kept it in his wallet so that when we went to the doctor, when I would take him to his appointments, a lot of times we would forget to bring the bag of all of his scripts in it, and he would have his list, and he would keep it up to date. And so then he had the list so he could give it to the doctor, and because he wanted to make sure that he was taking what he was supposed to be and the right dosage, and if he was having any side effects from that, he wanted to be able to tell that to the doctor. So to see 2 different ends of the spectrum when it came to medication was quite interesting.
That is brilliant. And I'm really glad you said that, because on the Porter Stark website and even to our WISE class, I have added that. So I found a really good, I kept searching until I could find a good template for a wallet card. And then I found one and I give it to the students when they take WISE classes. We gave it to, the interns have it to give to the Meals on Wheels clients because it is better in the long run to also keep your medication on you because if, a list on you, because if something happens, how is somebody going to know? You go to the emergency room for some reason and you're semi-conscious or you have an accident or a fall, who's going to know? And I will admit, I do not know everything my husband is on. So I count on it. I know that that's in his wallet. And so, if I needed to say something on his behalf, I know where to find it. They were also in one of the classes recently. One of the members that we had is pretty savvy with technology, and I guess there's an app you can put on your phone too. Unfortunately, I wasn't a good student paying attention to them because I don't remember what it was called, but all of that. But we did talk about the reality of having an app is helpful if somebody knows how to get into your phone. So, I mean, everything has its pros and cons. So the wallet card is perfect. So there is a copy of that on the porterstark.org website if you want to print it off.
That's good to know. I do want to say that I think I might know. I know for Samsung users, you can put your information into your phone, like your medications and that kind of stuff, and your contacts. And if you're having an emergency, it shows up on the lock screen.
Okay.
Where like if a paramedic came across your phone, they could access the pieces of information you put into it. That might be helpful for anyone listening. I don't know.
I'm guessing the smartphone, there may be ways that even our smartphones do that.
But I'm all for paper.
I don't know that yet right now.
Yeah. I'm all for, keeping a list on yourself too as well. I am an advocate for cover every area you can, right? Because you just don't know what the situation's going to be. So if you can keep it on your phone, great. If you can get it into your wallet, awesome. Make sure you have multiple ways for people to help you and to understand what's going on in case of an emergency.
You know what else that we just learned, and it's interesting because I was teaching WISE yesterday and my phone rang because I forgot to turn it off and I looked at it was CVS Pharmacy here in Valparaiso. And so I was laughing that, here I am teaching a class and now my phone is ringing. But the pharmacists are becoming more and more engaged in helping people with medication. And it was a phone call from CVS asking, do you need any help with your medications? You want to talk about it? And we had another member of a WISE class that mentioned that it was their pharmacist that caught the harmful effects that two medications would have. So people are hesitant because doctors limit their time. And so pharmacists are another really great resource. And if you have a pharmacist willing to do that for you, that is great to do. Meet with your pharmacist and talk about concerns you have over medications.
I know myself, whenever I go to the pharmacy, if I'm getting something from a doctor who isn't the same doctor, like if I get two medications, one from each doctor, I always go to the consult window and just say, hey, what do you think? Does this sound right? And they'll let you know. I mean, they're going to be direct, like, these two don't work together. You need to probably call your doctor back,
Yeah, there's basic things, even like if you're on certain medications, you can't drink grapefruit juice because of how it reacts in the body. Basic food things that you should know.
Or you can go into the sunlight on some medications. Like, your exposure to sun is like really bad. I mean, there is so many side effects. And personally, I just like to err on the side of chatting with my pharmacist when I get something I'm not familiar with, just to make sure that there's nothing I'm missing.
Well, exactly. And the effectiveness of some medications tend to be a little bit diminished or different if you're taking if you're taking an antibiotic for a certain period of time. And also something that happened to my dad was when you get yourself on over-the-counter stuff and then you're being prescribed something that's very similar, like a potassium pill, and you can, you know, be accidentally overdosing on potassium, which is what happened to him because they sell OTC potassium, and then he was being prescribed it, and he just didn't realize it, and before you knew it, he was completely way overdosed on the potassium. So really watching that.
You keep adding great things, Kaitlyn, because we keep talking about the medications. And I forgot to say, when you do that brown bag visit, you talk about your supplements and over the counter, because there are definite things, and I forgot to say that. So, yay. Yeah, that is true.
So you mentioned that nationally there's a pretty big, as the secondary leading substance for older adults, we have opioids. Was that correct? Am I remembering that correctly?
Opioids are part of the category that is increasing, unfortunately, in older adults, and older adults are seeking more treatment than they have been. The numbers are increasing significantly in that area. The specifics on the grant that I have from the Department of Mental Health and Addictions just looked at medication use, and that was part of it. So we weren't just looking at alcohol and opioids, we were looking at all those components we were talking about with medication. But yeah, there is an increase, and it is surprising. Those of us that are older adults, and even any age, maybe the two of you as well, you don't always know something's in that category. You don't know the name of that pain medication is actually an opioid medication.
Yeah, I feel like a lot of times the medications, at least from my perspective, it's hard to follow, right? Like they have these names and you get something prescribed, and then you go to the pharmacist and they give you something generic for that. And then, it just gets a little confusing. But yeah, I can definitely see how someone might not know whether or not they're being prescribed an opiate. And I guess I bring that up because I wanted to kind of segue a tiny bit into how to properly dispose of any medication that you are no longer using or that is expired, over the counter as well. Any of that, there's proper ways to dispose of that. And it's really important for people to know that, the proper ways to get rid of these medications, because left in your cabinet or in your closet, they can be used by other people in a way that might lead to substance use disorders. So it's very important to know that getting rid of them is a smart and responsible move. Here in Porter County, we have drop boxes for medications. Those can be over the counter or prescription, and those are located at most of the police stations here. However, I know nationally there is the Take Back Day that is sponsored by the DEA. You can go to that website, takeback.gov. You can go to that website and find a drop-off site in your community so that you can dispose of those medications properly.
There is another cartoon. Actually, it's a drawing as part of the WISE curriculum, and I believe we posted it also on our website. And it has the grandma, a picture of grandma, and it says, "You would never think that this grandmother is a drug dealer." And it's from the American Medicine Chest Agency, and it is talking about that. And we just taught this in our WISE class. At least 50 to 60% of the medications that somebody is misusing, they're getting it right out of somebody's closet. So if you have prescriptions that are either expired or you're not using, yeah, you do need to get rid of them. And putting them in, flushing them down the toilet is not a safe thing, because many of those prescriptions will get into our water supplies. So there are, like I said, I know our pharmacies here have it to drop off medications and not keep them in the house. But yeah, it's surprising. And of course, the older adult has the larger number of prescriptions in general, as we've been talking.
Yes, and I also think it's important. I don't know if you're familiar with Doterra Pouches. Have you heard of them?
Yeah, I have an office full right now. I would love to be giving them out.
That's right. I forgot that.
I would love to be giving them out, but you go ahead, talk about that.
Oh, okay.
That's wonderful.
Yeah, so Doterra Pouches are, I don't know who decided to make them, but they're wonderful. And they're basically like a pouch of charcoal. And you take a medication that you are no longer using or that you want to dispose of, and you put it into this bag. I believe with a bit of water, and then you
Yes.
shake it and it
Yes.
deactivates it, right?
Yes.
So then it's safe from that point to dispose of in the trash. And it
Yes.
won't affect our landfills or our land or our water supplies or any of that. So that's another option as well. And you have some of those here in Porter County. So that's pretty cool.
I have. They are now lining the side of an office. And had we not been in a pandemic, I would be having events and I would be handing them out and talking about this with all the other things if I could.
Yes.
Yeah, you're right. They do need, they are useful. And I think it was from a company that was responding to their own medications. It was a response, just like the smoking industry had to make some decisions about their commercial messages to people. This was the same thing. And at least it's safe then to, because you don't want to just put pills in the garbage either any more than you want to flush them down toilets. You
Right.
just, because of the type of chemicals that are in all of those things.
Well, I'm so glad that you have some available. We'll
I
have to
do.
talk about Take Back Day.
Yeah.
That might be a good way to partner with getting some of those out into the community. So, Diana, we have talked about a lot, and it's been a lot of really good information, and we don't have much more time. And I just wanted to make sure that there's nothing else that you feel really drawn to share before we end. If you don't have anything, that is okay too. But I like to kind of give a little bit of a heads up before we just end the show in case there's something else you wanted to share with us.
If people are interested in knowing about the WISE class and wanted to contact me, they could do that. I don't know if there's a way I could talk about my email address on this, but my last name is so hard to spell. But it's DILTZSCHE at Porter Stark with an E at the end.org, or they could call Porter Stark and ask for Diana Ilchi to talk about the WISE class. If somebody needs Doterra pouches and would like me to deliver them to you, I would be glad to do that. And I have a lot of information that we're hoping to put out in pharmacies and doctors' offices. We have a whole marketing process with our grant. And again, I've been doing this since July, but it's been a slow process only because of the pandemic. So you should be seeing some more things out in the community. I also thought of one thing I'd like to say. We were talking about medications. On that website, there is a pamphlet called Harmful Interactions, and it lists many common medications, and it's in a nice, organized list. And it will tell what happens if you drink with that medication. What are those side effects? So I point that out if somebody wants to grab that off of that website. Harmful Interactions is what it's called.
Perfect. So yeah, check it out. And get access to these resources. And this isn't just for if you are an older adult. If you are a grandchild of an older adult, a child of an older adult, and that these resources would be good for your family member, feel free to hop on the website, grab this information, and start giving them a little bit of support in these areas, because as we know, as Diana has so wonderfully illustrated today, there's a lot of resources that can be really helpful in addressing things that maybe they aren't quite comfortable sharing with other people.
The other thing that real quickly that you said, but for family members, is a lot of times you don't know that your grandparents maybe are drinking a little bit too much or drinking to fall asleep. And a lot of times substance use looks like other conditions older adults might have, like memory problems, changes in sleeping, sadness, chronic pain, eating habits that change. And so we don't always realize that that's really what's going on. Because we think, what harm can it do? You're not working anymore. You're not going to be drunk driving. So what harm is it that grandma's drinking 3 or 4 drinks a night? But now we do know, and I've learned, that the harm to the body is the problem. And it's not, that is actually a type of binge drinking. So younger people that can be looking at grandparents or even concerned about their mood. Check in with your grandparents on their mood. How are they doing? All of that's important.
Absolutely. Absolutely. I mean, we just got to take care of our people, no matter, if they're older adults or, other family members. We just got to make sure we're taking care of each other. And you guys are providing wonderful resources for that. And I really appreciate you sharing them with us.
And one other thing I wanted to remind everyone of is the My Strength, which is also a resource that can be utilized by anybody on the website, Porter Stark. That's an E at the end of stark.org.
And that definitely helps with your health and mood. I've signed up. So, yeah, and they send messages. Yeah, it's a good resource.
Porter Stark is just doing a lot of wonderful things. Well, Diana, thank you so much for joining us today. And thank you all for listening to this episode of Matters of Substance. We appreciate it. And of course, if you need any more of this information, you are welcome to reach out to Diana. She shared her email. And you can also give us a call here at the Substance Abuse Council, and we'd be happy to connect you with her if you need that as well. So
Great.
thank you for coming today.
Thank you. Thank you to both of you.